All right, Ben, but we're going to begin with the coronavirus and the weekend numbers. The state reporting 3,881 new cases over the past 48 hours, averaging out to 1,940 a day. And along with that, 29 more deaths from COVID-19 have been reported, that over the last 2 days. Now, those numbers continue that rising trend that we have seen over the past few weeks.
A month ago, cases were in the 700s, and it doesn't seem to be letting up. So let's bring in Priya Mann tonight. Priya, the state's top health officials had a big update today, and this is a problem everywhere.
Yeah, that's right. You know, they say there isn't a region of the state that is immune from a significant increase in COVID-19. And experts say about 80% of the epidemic can be traced back to just 10 to 20% of those infected people. And now these troubling trends have health experts extremely concerned.
What we see now is a bit of a new phenomenon, is that we're seeing increases across the state in all different regions.
Epidemiologists are sounding the alarm after Michigan broke records over the weekend. And on Monday, another 3,800 cases were reported over the past 2 days.
The magnitude, the speed of this increase is unlike anything that we've seen since the spring.
Now the fastest growing demographic is young people, which can be a double-edged sword. They're not as likely to be hospitalized, but are more likely to spread the virus.
Recently, the CDC released a report, talks about a younger adult that was mildly infected, went to a family gathering, and then subsequently resulted in infections of more high-risk adults that were in the family group.
While Michigan was able to flatten the curve initially, hospitals have been preparing for a second surge.
The virus is the curve. We are the horizontal line that we have to keep above that curve. We are the capacity that's necessary to move up above that curve, such that at any given time, wherever that surge is at, we have the capacity as an organization to respond.
Henry Ford says it has 100 days worth of PPE supplies for frontline workers. But officials warn this time around, hospitals will not likely be able to focus solely on COVID-19 patients.
The second time around, we have not as high as optimism that we will be able to shut down our entire operation to focus only on COVID.
And of course, that will become a huge concern if hospitalizations significantly increase. Now, health experts are hopeful because there are things that we can do to stay safe. Coming up at 6, important reminders that we can all do as a community to keep every Michigander safe and to stop the spread of COVID-19. Reporting live, I'm Priya Mann, Local 4 News.
And Priya, a quick word about what they had to say about restaurants and bars.
So remember last week, Dr. Khaldun talked about, she recommended wearing a mask the entire time you're in a restaurant, except when you're physically eating food. Well, experts are also talking about the fact that whenever alcohol is involved, inhibitions go down. You're less likely to wear a mask. And as colder temperatures are on the way, you're going to have more people indoors who are eating together, and that can also increase the spread.
Yeah. All right, Priya. Now, today we are also getting new data on COVID-19 outbreaks at Michigan schools.
Let's take a look at some of the broad strokes. In all, 30 new schools reported outbreaks of 2 or more cases in the past week. 5 of those schools are in Macomb County, including Dakota High School with 5 new cases. As far as ongoing outbreaks, Michigan State University tops the list with 1,664 cases.